I'm Dr. Janelle Delica. I'm a board-certified periodontist that works in Palm Beach, Florida. I have helped countless smiles to be restored to optimal health. But what is periodontal health?
Periodontist? Periodontal health? Huh?
The periodontium comprises of the alveolar bone, the gum tissue, and the periodontal ligament. These three tissues make up the support for your teeth. If you think of the periodontium and your mouth as a tree, the tree would be your teeth, and the roots are included in the tree. Everything around the roots is the periodontium. So in the same way, if something comes around and erodes away the soil, your tooth can fall out, just like a tree could fall down. And that's essentially what periodontal disease is. When we think of infections, typically a magic antibiotic or pill can make it go away. Unfortunately, periodontal disease does not follow this. Because it is a host-mediated disease, that means that it's a combination of your genetic makeup, how your body reacts to bad bacteria, and the bacteria that's in your mouth. We all have bacteria, there's no getting around that, but we can help to encourage healthy bacteria to be in our mouth by staying on top of our cleanings and taking care of periodontal disease the moment that it starts. But what if you have gingivitis? Well, gingivitis is when the inflammation in your mouth is limited to the gum tissue. In this instance, you've not lost any bone as yet. Gingivitis is reversible. By taking care of your oral health, visiting your dentist or hygienist on a routine basis, and taking great oral health care at home, you can reverse gingivitis, which is typically manifested by bleeding on flossing or even when you're brushing your teeth. You may even have red or fiery gums. But again, if the infection and inflammation is limited to the gum tissue, you are at an early stage of periodontal disease. On the other hand, periodontitis occurs when you've actually lost bone due to the inflammatory process of periodontal disease. This is evidenced by radiographs. It will also show up in the numbers that we look at when we are doing our periodontal or dental charting. It can even be evident by teeth that are moving or shifting within your smile. Unfortunately, by the time a tooth starts having great mobility, it's probably too late to arrest the disease. Because of this, it's important to see your dental healthcare provider on a regular basis. You have gum disease. Now what? Well, thankfully, there are treatments that we can do to help bring back either the lost bone or soft tissue that you lost. The earlier we treat the disease, the better your outcomes. Once upon a time, the only thing that we could do was cut away. But since then, our field has evolved. Not only can we add back bone or add back tissue that's missing, we can also use different lasers to help regenerate tissues that have been lost due to periodontal disease. The key is to be diagnosed early within the process.
I hope you enjoyed this video. Please like, share, and subscribe, and drop in the comments any questions that you'd like me to answer next.